Tonight, we are going to be talking about how you can improve pain without more medications. Because let's be honest, whenever we have pain, the first thing we want to do is pop a pill because a pill can sometimes quickly help us get rid of that pain. But those pills, all those medications, they can have a detrimental effect on our body long term. Now, don't get me wrong, there is a time and place where we may need to have medications assist with decreasing pain and other symptoms, such as numbness and tingling, burning, those nerve like symptoms I just mentioned, and also decreasing things such as swelling as well. So, when it comes to pain, pain can be classified in different ways, and sometimes medications can be needed, but they should not be the long term solution. And in some cases, they should not be the first solution. So if you're looking to try to manage pain without adding more medications to your life, then this conversation is for you because physical therapy is just one of the types of interventions that can help. Well, one of the professionals that can help you manage your pain, live a better quality of life, and also get off some of those medications that you're taking, not just for pain, but for other things as well. So let's talk a little bit about pain. Let's talk a little bit about medications. And that way you'll understand some of the impact that these medications can have on you. That way you'll know what different things you should look out for. And then we'll move into how physical therapy can be beneficial in helping you manage pain. Now, when it comes to pain, there are different types of pain. It's never one type of pain. And pain is also very hard to measure because it is something that is more subjective. It's something that the individual themselves is experiencing. So I cannot necessarily question someone's pain. If someone tells me that their pain is a 10 out of 10 or 8 out of 10, that is what they are feeling at that time. But the different types of pain can let us know where the pain may be coming from because a nerve pain is going to be very different from that of a pain related to a joint or even a muscle. A lot of times with muscle pain, people will complain of sometimes having like a achy pulling sensation, something that feels sore, extreme soreness, I should say, and even at times something that's kind of grabbing or spazzing. When it comes to more of a bone or joint related pain, people will complain of like a dull ache. It hurts with certain movements, certain activities. And then also with the joint pain, sometimes people will notice that they're not able to achieve the full motion at that area as well. That can also occur with different muscular based pains. So they can go hand in hand at times. Now, with certain types of joint pain, especially related to things like arthritis, individuals may also complain of stiffness. And stiffness and pain are different, but they can be related. Stiffness is when you're not able to move a joint very well, and it kind of takes some time to get warmed up. So imagine if you have that creaky door and you use WD-40, your body makes its own type, I guess you could say type of WD-40 for a lot of these joints. So sometimes you just need a little bit of movement to kind of get the joints better lubricated, and then that stiffness can go away. And that's very common with arthritis, which still stiffness can be related to pain, but it's not the same thing as pain. Now, when it comes to nerve pain, earlier you heard me mention sometimes people can complain of like numbness, tingling, and burning sensations, or even like sharp shooting pains. That is more so a nerve-based pain. So that's letting us something's going on with that nerve. There's some type of irritation in that area. So the type of pain that you're experiencing can determine the type of treatments that are needed. Just like one medication is not going to help all pain, one treatment is not going to help all pain per se. So it is important that when you are describing your pain, that you give us as much information as you possibly can, because that can help us better guide treatment as well. So now that we talked a little bit about pain, it's important for me to also mention that acute pain and chronic pain or persistent pain are very different things. Acute pain typically occurs because there's been some type of injury or something that has occurred within a short period of time that has resulted in you having pain. But persistent pain is something that is occurring and it has lasted for a period of time. Generally speaking, depending at the source that you look at, they'll classify persistent pain as anything lasting more than 3 to 6 months. So for people who've experienced back pain, because that's one of the most common areas for people worldwide to experience pain, if your back pain has lasted for more than 3 to 6 months, then you are falling into the pain category as more persistent or chronic based. And that can just give us more information when it comes to treating as far as what treatment options may be best as well. Because there are times we're going to treat acute pain very differently than what we treat chronic pain. For instance, if I'm walking down the street and I step down the curb and I twist my ankle, first thing I may notice, I may have swelling and I also may have pain. So my first goal in this case is to get rid of the swelling. So that way, as I get rid of the swelling, I can also help with the pain. So a lot of times with this, you'll hear people refer to saying, okay, maybe we need to do compression on this area. Maybe we also need to apply ice to try to help get the swelling down. NSAIDs may be appropriate in this at this time as well. So talk with your provider if you have more of an acute injury that has resulted in a sprain or even a muscle strain. So that way you can see if an NSAID is appropriate. However, that acute pain is very different from someone who's having chronic pain. So someone who's had an ankle sprain, maybe a few years ago, but that ankle pain is still there and it's not getting better. That is more of a persistent or chronic based pain. They generally don't have the swelling that we associate with the acute injury, but they still can have some of the pain and limited range of motion at that joint. So those two scenarios are going to be treated very differently. For one scenario, my first goal is to try to get the swelling down so that we can also impact the pain and gradually improve strength and motion as those structures heal. Because if we have an ankle sprain, we know that certain ligaments have been stretched out. Now, if someone's had a chronic ankle sprain, meaning that it occurred over a period of time ago, and with that, those symptoms now with the pain are still there, or they're even noticing that they don't feel quite as strong, the approach is going to be different. Because even though they may be having pain, you may think movement is not a good thing. But in this case, movement is a great thing. It's just about how we go about moving the person to make sure that we're not worsening symptoms, but also make sure that we are able to help reestablish the motion and to improve their pain. So I hope that makes sense as to how persistent pain and chronic pain can be treated differently from the very start, but physical therapy can help with both of those. So we talked a little bit quickly about pain and the different types of pain that your body can experience. We also talked a little bit about how someone can have acute pain, so an injury that just occurred versus chronic pain, pain that has been long-standing. So now this is what you really want to know. How can physical therapy help? Well, you probably have heard the saying that movement is medicine. And that is true. Movement is medicine. We want to make sure that we can keep you moving, because if we can keep you moving, then long term, we can keep whatever area is in pain healthier, because movement is going to improve the circulation to the area, and the circulation is going to bring that blood flow is going to bring a lot of healing factors. So that way those tissues can continue to remodel and repair. And even with more persistent or chronic injuries, this can occur because you're increasing the circulation. With movement itself, though, there's a gradual approach that has to occur regardless if the injury is acute or chronic. And the gradual approach is going to depend on the individual and also the symptoms that they are presenting with. So it's never a one size fits all. It's never a one stretch is going to fix everything and be the perfect opportunity for each time you see a particular diagnosis. So you want to make sure that we're taking the time to evaluate your movement, to evaluate your complaints, so that way we can best address you and make sure that you're getting something that is tailored just for you. So with us incorporating movement into the activities, I know the first thing you're probably thinking, why would I move when it hurts? Well, I could tell you because science and research supports that is a good thing to do, which is true, but that's not beneficial for you. So I already mentioned that circulation can be a good factor that occurs because of movement, but also movement in itself is important, especially when we're trying to help retrain the area. Because in certain situations, when someone's had an injury for a long period of time or even pain for a long period of time, our nervous system begins to respond differently, and it begins to see everything as a threat. So to help decrease and minimize that, we want to keep you moving gradually, so that way we can start to retrain the nervous system, which is plastic, meaning that it can kind of remodel and reform as time goes on. We want to make sure we retrain your nervous system so that way you can accept what are normal stresses against the body. For instance, it should not hurt for you to stand up out of a chair. However, if it is, that is a process that we need to make sure we're gradually going through, so that way we can help to retrain your body, not just the muscles to get you stronger, which can help, but also your nervous system. So movement is a good thing for circulation. Movement is a good thing to help retrain the nervous system, so that way it does not perceive certain things as stresses. And movement is a good thing to help keep you strong. If we can keep you strong and keep your mobility, that in itself can help to decrease the occurrence of pain and recurrent pain. So if you're having pain, yes, we want you to move. The best thing that you can do if you're having hip pain or back pain is get out and walk. So that way you can try to keep those muscles engaged, keep the core engaged. Also, depending on the location of the hip and back pain, sometimes reestablishing your normal movement, making sure you have motion throughout the hips in all directions. And same thing with your lumbar, your lower back, that portion of your spine, making sure that you haven't lost any mobility in that area as well. So that's usually the biggest thing when people think of physical therapy, they think of movement. And we are movement experts, we are movement specialists, but there's so much more that we can do so that way you can move better. And that we work a lot with our hands. So there are different things that we can do when it comes to manual techniques to try to help get tissue moving better, decrease any restrictions we may notice in the area, also to try to help with the nervous system. I'm going to say that again, because a lot of times the simple touch itself can help with the nerves the nerves in the area recover, and also allow for the nerves to be able to accept certain stresses. So with manual techniques, yes, we can do joint mobilizations, which is where we're seeing exactly how much the joint is moving. And then within that mobility, trying to work on either reestablishing the motion of the joint or working on decreasing the pain that the joint has in the movement. In certain areas, certain states, this is state dependent. Physical therapists can also do what people would call a manipulation, which is a high thrust technique. So that way we can, once again, reestablish movement, but also help to kind of reset the nervous system and get things moving a bit better simply with that high velocity thrust. Other manual techniques we can do include various types of massage and soft tissue mobilizations, myofascial release. A very common term right now is trigger points. So yes, we can also work along different areas of that. So that way we can try to decrease your pain, decrease any restrictions in the muscle, and also allow for you to move better with less restrictions. Now, manual therapy is not limited to us just using our hands. There are certain times when we may use different tools. That can be cupping devices where people will use the silicone cups or the glass cups. So that way we can utilize the cupping techniques to try to help improve circulation, improve mobility, decrease pain, those different things. There are also times when we can use different massage-based tools, which are like little metal devices typically, and they're stainless steel. So they can be a little cold. So I typically try to warm them up in between my hand for my patients. That way they're not as shockingly cold to them. But that can help us to loosen up some of the fascial restrictions that are in certain areas, and also allow for us to be able to work as people are moving throughout motions as well at more of a focal point. So those are some of the manual things we can do. And I probably should go ahead and include dry needling in that as well. So depending on the area and the state that you're in, physical therapists are allowed to perform dry needling. And dry needling is where we are taking a needle and inserting it into the muscle. And with us inserting into the muscle, there are different ways that we can allow for a muscle to kind of reset and relax to help decrease pain. It also will increase circulation to the area as well. And then there are times for individuals who are having like nerve-based pain where we can do something called like a perineural-based needling to decrease the pain for that. With the dry needling, we can use just the needles, or we can also use an electric current, just to, which is more so, typically it's not something I do with the first visit with dry needling with everyone. I have done it on the first with some people, but generally speaking, I'll use just the needles. But the electric current itself allows for us to kind of amplify the impact and effects of the needling. Other techniques that we can use, so we mentioned different manual techniques, which included the dry needling I just mentioned, also like the silicone and the glass cupping techniques, the tool-assisted massage techniques. We also can utilize other modalities in addition to us using the skills I just mentioned. And if you're wondering what a modality is something that we use to adjunct, meaning to go along with the other treatments that we're doing, because the goal is to get you feeling better and moving. So sometimes we need a little bit of extra assistance with that. And one modality that is very popular, and you can actually order your own in most cases, is a TENS unit. So a TENS unit is like a little device, which you can use. Some of them come preset. Personally, not a huge fan of all the preset ones because we cannot adjust the settings typically to what we need for that individual. And not everyone is going to respond to the same preset. But if you have a preset and it's working for you, great. It can be a great place to start if you don't know where to start to try to help decrease your pain. And TENS units they're pretty safe. So the chances of having a reaction to a TENS unit are really low. But the biggest thing is that you want to make sure that you don't have any medical conditions that can prevent you from utilizing a TENS unit. And so if you have questions about that, I can go over that in more detail in a different video or even later in the comments. But there's certain conditions we don't want you using a TENS unit with. But a TENS unit is simply like a little box that produces an electrical current. With electrical current, where we put pads surrounding the area where individuals have pain. So now that way we can cause for stimulation in that area to help stimulate the surface level neurons. So that way we can try to help decrease pain. And the type of setting that we're using on the TENS unit is dependent upon the location of pain, the type of pain that you're having, and also, believe it or not, the medications that you are taking. Because if you're taking opioid-based medications, there's certain settings on the TENS unit that will not be as not as effective for you. So it's important that if you are taking medications, that you know how to adjust that machine. But a TENS unit is something that you can use in the clinic. If you've ever been to a physical therapy clinic, you'll see sometimes that they have a much bigger device, which has different types of stimulation that you can use. But a little TENS unit is something that you can get off of Amazon, and I will put in the box below just some different recommendations for what I typically use with my own patients when I'm seeing them. But like I said, before you try any type of TENS unit, make sure that you speak with your provider. Make sure you have someone do a formal assessment, because you want to make sure that you don't have a medical condition that you should not utilize it with. Okay. So other things, this one is becoming very popular, red light therapy. So red light therapy is extremely safe. Right now we know that individuals who have a history of skin cancer likely should not use it. So that is the biggest reason as to why I would say let's not do this. But otherwise, red light therapy is pretty safe. Generally, you can buy some at-home models online, like on Amazon, but they're usually not as strong as what the medical grade. So it's important that you at least do a little bit of research, so that way you can get one that is FDA approved, but also provides you with the range that you need for the actual light wave itself. So red light therapy is exactly what it sounds like. It is red light that you are using to help improve circulation in the area. It can be good to help decrease pain, decrease muscle spasms. There are also some benefits that certain spas are using when it comes to the skin, because we know that as it increases circulation, that it causes for the formation of more blood vessels, which is angiogenesis. So it causes for more blood vessels to form, which can be really beneficial for the health of the surrounding tissues. So red light therapy is showing some good benefits. Some people respond well, some people don't, but it is something that you can at least try. It is generally something that you need recurrent treatments on for a certain period of time in order for you to notice and experience the impact. Generally speaking, with the TENS unit, the one that I just mentioned, people will notice improvement in their symptoms immediately and just after using, and then that one they can also reapply again. So another modality that you already may have at home is something as simple as heat. And sometimes heat can be a wonderful thing to try to help relax the muscles and also increase the circulation to tissue. So heat is something that is good to use, but I caution you if you have an acute injury. So if you just hurt yourself, heat is usually not the best go-to, because at that point, heat can cause more swelling in the area, and we want to try to get the swelling out. So that is usually the one time where I will not use heat. There are some exceptions to that rule, but if you have a question, talk with your provider. That way you can see what the best option is for you. But generally, if you just had an injury, ice is the better choice if you've just had that injury, okay? But with heat, the biggest thing that I want to say with heat is don't leave it on too long. Simple as that. With the heat, you want to make sure that your skin is not getting burned. So typically have a layer in between yourself and the heat. Depending on how hot the heat gets, you may need more than one layer. People like to fall asleep on them. Don't set a timer, so that way, especially the ones that cut off automatically, those are great. Otherwise, set a timer so that way you know to come off of it, because you can burn yourself even with the heating pad, and we do not want you to do that. So just know that, yes, this is something that's, once again, safe. You can buy typically a heating pad offline. A lot of the newer ones now are coming with the automatic shutoff, which is great, because people were burning themselves. So just make sure that, you're setting that timer if you don't have the automatic shut off, so that way the heat will cut off for you automatically, okay? Awesome. So other modalities that we can use when it comes to treating pain. There is also, especially when it comes to smaller joints, there's something called paraffin, and you probably have seen paraffin at like some of the nail salons when they're doing your hands, doing your nails, because they can actually use the paraffin itself to try to soften the hands and also to remove some of the dead skin as well. So after they soften the hands, they'll go to remove the dead skin around the cuticles. But paraffin has a therapeutic benefit as well, because once you heat up those small, tiny joints, now you can actually move a bit better because you've increased the circulation, increased the activity in that area. So there is a therapeutic reason to use paraffin as well. So physical therapy has so many different options. So before you jump straight to taking more medications or immediately jump to surgery, give physical therapy a try. There are some times where surgery is the best answer. So I'm not going to tell you that physical therapy is going to fix everything, because there are times, and I will say it again, there are times where surgery is going to be the best answer. But for most people, that's not the case. We actually have research that shows us that individuals that have meniscal based, like more of like a meniscal derangement, so over time, the meniscus at the knee itself has kind of been wearing down. We have studies that show us that physical therapy, with the outcome compared to that of surgery, that they're pretty much the same. So before you even just consider surgery, if you have more of a degenerative based meniscal injury, so meaning that the meniscus has worn down over time, you may want to just try physical therapy, because it's showing us that when it comes to pain control and also return of function, that physical therapy and surgery have pretty much the same outcome. So why not try physical therapy first, especially because if once you have surgery, you're going to end up in physical therapy anyway. So physical therapy is a really good choice if you have a meniscal injury that is related to degenerative changes. When it comes to low back pain and neck pain, a lot of people automatically think I need to have imaging done. I need to have an MRI done on my neck and my back so I can figure out what's going on. Well, if I were to take people off the street and do imaging on their neck and on their back, even people who do not have any symptoms whatsoever, they probably would have signs of some type of disc bulge, which means that they would be at higher risk for having like radicular symptoms because the nerve would be irritated. And by radicular symptoms, I mean they would have pain either in the neck or back, depending on where that disc bulge is, and potentially pain down into the arm if it was the neck, and pain down into the leg if it was at the back. Now, that's what they should have. But like I said, a lot of individuals, if I were to just take someone off the street, they probably would have the symptoms according to the MRI, but they would not actually have the symptoms of that. So getting imaging is not always the best answer. Trying physical therapy first to see if we can alleviate the pain. And there are times where someone may have more inflammation in these areas. Well, yes, some medication may be appropriate to assist as well. But physical therapy should still be a part of the conversation, because medication should not be the long-term choice. It should not be that way for everyone. Majority of people are going to respond to conservative treatment, meaning things without surgery. Majority of people are actually going to respond pretty well to physical therapy, so that way they can get their life back, they can restore their function, and they can return to the activities that they enjoy doing, all while decreasing their pain. So before you jump straight to surgery, before you conclude that you need more imaging or initial imaging, give physical therapy a try, because we are specially trained to help you move better, to help you thrive with movement, and also to help you learn different patterns to decrease and minimize your pain. It does not matter if the pain is acute or if the pain is chronic. We have different tools and strategies in our toolbox, in our knowledge base, that we can help and assist with this. So I hope this information was helpful. I hope that you were able to learn different ways that we're able to decrease pain and manage pain without more medications, and also without having to rely solely on imaging and surgery. So if you have questions or even comments about something particular that I did mention, because I know this was a really general overview. So if there's something in particular that you'd like more information on, feel free to let me know down in the comments. And who knows, I may be able to do another video so that